We see people with allergies that can be either seasonal, which is once or twice a year, lasting 3 to 4, 6 weeks. Then you have other people that have what we call perennial allergies, where their symptoms last year-round. Sometimes when you develop symptoms, it's confusing because you don't know if you have a sinus infection, upper respiratory infection, cold, allergies, any of those. And if you're not familiar with that, haven't had those symptoms before, it's sometimes hard to tell the difference. With allergies, traditionally, you're going to have sneezing, itchy eyes, watery eyes, itchy nose. The mucus that you get out of your nose is going to be clear, not cloudy or discolored, and also rarely would you have fever associated with allergy. So if you're experiencing allergy symptoms, avoidance would be the first thing, but if you're allergic to tree pollens, grasses, weeds, that kind of thing, you really can't avoid that. So then you're faced with medications, and as of recent, there are nasal sprays which are specifically for allergy over the counter, and they also have antihistamine pills. If it's seasonal, you may only have to use that for weeks at a time. If it's perennial, it could be something you need to use year-round. If you're having problems responding to our over-the-counter things, then the next step would be to consider getting your primary care doctor involved, because sometimes there are other medications. The medicines that we use for allergy, such as the nasal spray and the allergy pills, antihistamine pills, they are what we call treating the symptoms. So they're basically taken by people to try to improve their, or make it where they can deal with their allergy. If you go to immunotherapy or allergy shots, that is specifically, it starts with a very low dose and you ramp up that dose over a period of many, many weeks, but you're trying to reduce somebody's response to the allergies. So you're not really treating them, you're reducing it so that when you get up to what we call maintenance, once you're there, you would be less responsive to whatever's you're allergic to. So it's trying to reduce your reaction, if you will.